I've got videos on how to do this. The link will be at the end. And when you check your chest, please remember that you need to check the whole breast area up to the collarbone and down into the armpits. And this is the same for both genders. So how do you do it? So it's a bit like a cross between the Time Warp and the YMCA. First of all, what you want to do is, excuse me, you stand in front of the mirror topless. Obviously I'm not going to do that today. But if you have heavy breasts, you might need to lift them up to see the underneath. And what you want to do is you want to look front on, and you're looking for any changes in the outline, changes in the skin texture. Have your nipples suddenly started pointing in? Are there any lumps that are sticking out from underneath the skin? Is there any sudden visible change in size, in shape or in contour? And you want to stand to the side again and look in the mirror, and you want to do the same on the other side. Okay? And next what you want to do is you want to put your hands on your hips and you want to lean forward slightly, okay? And then you also want to go back up and just pop your heads, put your hands between your head like this. And the reason that's important is that sometimes when you change the tension of the skin, you will reveal things that you can't see just by looking straight on. My lump, it wasn't visible just looking straight in the mirror, but when I popped my hand up behind my head like this, I could see it made my pec muscle stick out, and it could see the lump sticking out from under the surface. Okay, and the next thing you're going to do is you're going to feel your chest. And the way that you want to do this is ideally sitting down or lying propped on a pillow, and the reason for that is you're going to be pressing the breast tissue against your chest wall, which makes it easier to feel. I'm going to get my crocheted cheese wheels out just now to show you, because there we go, and like all normal human breasts, they're a bit wonky, okay? And what you want to do is you want to take the pads of the under surfaces of your 3 fingers with your fingers straight and bent at the knuckle like this, and you want to apply a firm and even pressure throughout the breast. So you're going to feel around the breast like that. Okay, some people like to go around the clock, some people like to go in quadrants. It doesn't really matter what way you do it, as long as you cover the whole area. Make sure that you don't forget the nipple, okay? And then you're going to move up from the breast area, up your chest wall, up to your collarbones, which are these sticky outy bits here, okay? And then lastly, you're going to have a feel in your underarm. You're going to feel under your arm and feel around in here, okay? And you want to be doing the same thing on the other side as well, okay? So you're going to feel all the way around the breast, okay? Feeling all the way around. These ones are a bit heavy, you want to lift them up, have a little press, okay? You're going to not forget the nipple area, and then you're going to work your way up the chest wall, up into the collarbones, and then you're going to have a feel of, this armpit, with the other hand, have a feel underneath the armpit, okay? What I cannot stress enough the importance of being body aware. I'm going to take these off now. I have sadly seen too many patients who have presented late with a late diagnosis when there were clear early signs that could have been picked up and could have made a difference to their outcome. Sometimes it's fear, and that's absolutely understandable. But if we catch things early, we can potentially cure them, and we can certainly get the treatment started first. We've all got busy lives, but you would set a calendar reminder to go, on a social with your friends. You'd set a calendar reminder, for your work meeting. So take this opportunity today to set yourself a reminder, a regular reminder to check your chest. Message your friends and tell them to do the same. Ask them to join you doing it. Post it on social media and share it with your contacts. It could save a life.